Electronic referral pathway for GPs to primary care teams Community Healthcare Network 7 North Wicklow.
So the title of our project was an electronic referral pathway from GPs in community services into clinical therapy in primary care. We established this as part of the Community Healthcare Network learning site as part of the implementation plan. It emerged from our stakeholder engagement when we linked with our GP colleagues, with our clinical therapy services, with our clients through a survey and a focus group. We discovered that the key challenge was for clients accessing services and the referral pathways. We had a number of different options in terms of paper referrals, emails, post-its and faxes, and we changed this to one streamlined referral pathway from our GP colleagues into primary care. So really the basis was around communication. It was supporting the two-way communication between our GPs and our primary care services, where they knew that their referral had been received and their client was on a waiting list or had been seen. It also gave us an opportunity to audit the information being referred. So it was a quality improvement project that we had identified through work with the RCPI and our colleagues in the Royal College of Physicians. So it was an opportunity to look at the information that was being shared on a referral into primary care and to improve that information to maximise our clinical decision making in primary care.
Integration of existing Warfarin and DVT service at University Hospital Limerick.
Hello, my name is Maura Fitzgerald and I'm Head of Nursing Integration and Development in the University Hospital in Limerick. Prior to 2020, the nurse-led Warfarin clinic, the nurse-led deep venous thrombosis service and the consultant-led anticoagulation review clinic had been working independently. As a result of the COVID-19 pandemic, the services were integrated to provide a comprehensive outpatient anticoagulation DVT service based in the Rapid Access Medical Unit in the University Hospital Limerick. This is under the governance of Haematology and Acute Medicine. The current anticoagulation DVT pathway was revised, agreed and signed off by the multidisciplinary team, and a dedicated IT system was developed to capture patient data and service activity.
Our nurse-led Warfarin clinic sees 40 to 60 patients a day. We provide ongoing education for all patients taking anticoagulation, as well as giving advice to medical teams on the wards.
Since we established as a unit in 2020, 2,750 patients have been seen in the DVT service, and 50% of patients have been referred directly by the GP. By directly accepting the patients from the GPs, we bypass the busy emergency department. One of our key performance indicators is the admission avoidance. So less than 2% of our patients that have been seen in this unit had to go on to be admitted for further investigations.
Oncology Outreach Clinic, Primary Care Centre, Tullamore.
The Community Oncology Clinic provides a nurse-led delivered service to the oncology patients of Midland Regional Hospital, Tullamore. This service provides chemotherapy disconnect, CVAD management, PICC line dressings, IM injections and venipunctures to patients of Midland Regional Hospital, Tullamore and the Laois Offaly area. This project developed from the COVID pandemic in March 2020, and this was a facilitation piece from community with our colleagues within the acute service of Midland Regional Hospital, Tullamore.
The patients love the service because it's time specific. It has greatly reduced waiting times for them. They're in and out within 10-15 minutes. From March 2020 to December, we saw 534 patients in 3 afternoons a week. In 2021, we saw 990 patients. And then last year in 2022, a total of 1,022 patients were seen in the 3 afternoons a week. So this is a service that is growing, has great potential to expand and maybe, to remove other services from the hospital and to be looked after in the community where they're getting a service in the right time, the right place and the right environment. All the principles of staunch care.
Pathfinder, Alternative Care Pathways for Older 999 Callers, Beaumont Hospital and the National Ambulance Service.
The Pathfinder team began in 2020 as a pilot project funded by the Staunch Care Integration Fund. The Pathfinder team activates an advanced paramedic from the National Ambulance Service and an occupational therapist or physiotherapist from Beaumont Hospital to 999 calls for non-life threatening and non-urgent complaints.
When we go out to a 999 call, the Pathfinder advanced paramedic and therapist complete a comprehensive assessment of the older person in their own home. A joint decision is then made with the older person themselves about whether transportation to the emergency department is needed or whether a safe and appropriate alternative is available. If the person remains at home, Pathfinder input doesn't end there. The Pathfinder occupational therapists and physiotherapists can follow up for up to a week or so. This is a crucial part of the model and has huge benefits in terms of safety and continuity for the older person.
Over the last 12 months, we've seen 611 patients following a 999 call at home. 62% of those older people remained at home rather than travelling to the emergency department. A retrospective cohort study over the last 5 months proved that Pathfinder is a safe alternative to the emergency department. Significantly, it's what older people want. It's the right service at the right place at the right time.
Integrated Leg Ulcer Clinic, Tallaght University Hospital, in collaboration with CHO7.
This service is led by Tallaght University Hospital in collaboration with CHO7. It allows for better management and timely management of patients with venous disease, particularly leg ulceration. From looking at the outpatient waiting list, it amounted that 30 to 35% of the activity in outpatients was made up for venous disease and leg ulceration. So it was deemed that having a specialised clinic like this one will actually free up the waiting list and also improve timely appointments for those that need it most. At the Integrated Leg Ulcer Clinic, patients are reviewed within 3 weeks of the referral from their GP or public health nurse. They get a timely vascular assessment, they get timely treatment with diagnostics, and this timely management means for better healing of their conditions. In the clinic, patients are given an hour's time. Patients feel very happy with this. They are not open to any further infection, and also they have time with me, especially time to talk about health promotion, which is crucial to any chronic disease. Another aspect of this clinic, it can be used as a rapid access clinic. So patients that may require to come to the ED can come to this clinic for treatment. The Integrated Leg Ulcer Clinic started in 2019. To date, 950 patients have been seen, which equates to 2,800 clinic appointments. In summary, this service has made a massive impact in patient care. Patients love coming to the clinic, but also the benefits to healing times, timely referral and reducing ED is the main impact it has had.
We're delighted in Tallaght University Hospital to have the Integrated Leg Ulcer Clinic as part of the services we offer our patients in this region.